bed is raised at a comfortable level for you. I don't want to be down here and using poor body mechanics. I need to protect my back too. If you're hurt, you can't help anybody else. So, now remember in the figure 5-14, the therapist's body was between the patient's body and the arm. Now, let's think about what we're doing here. Here's the head of the humerus, and then, you know, if I could see it, the glenoid would be up here. All I'm doing is taking the head of the humerus and pulling it away from the glenoid. That's distraction, okay? So I'm going to come up in here, and I can use kind of my iliac crest, you know, to support her arm. I've got you, don't I? I mean, you're relaxed. I've got full support of her arm. Now, my distal hand is going to be, I'm not down here at the elbow, I'm above the elbow supporting. My proximal hand is going to be as close to the joint as I can get, and I'm doing nothing more than distracting or pulling this bone away from the other one. Now, you want to use, you want to get up in there and be as close to the joint surface as you can. In other words, I don't want this hand down here and trying to distract. I've got to get it up in here, and you can really, you know, see the difference when I do that. The other thing to watch is to try to use the flat of your hand. Don't come in here and be pinching, you know, with your web space. You want to keep, that's not comfortable for the patient. Keep your hand flat, and see, I tend to pull down and then out. But really, and you may see some therapists using this as the arm pull, the distraction. But in this, for this technique, it's this. Okay? Now, the difference between the grades 1, 2, 3, 4. Honestly, a grade 1 would look just very, very small, right? It's a small amplitude, not reaching any, but when I get out here is when I'm feeling, and there's going to be a spot where even in normal you can't go any further, right? But grades 3 and 4, we are coming out here where there's restriction and moving. But grades 1 and 2, 1 would be, I mean, literally about like this much motion. It's a small amplitude. Grade 2 is a little bit more, but it still doesn't reach the restriction. And again, I am an oscillator. This is oscillation, just back and forth. If I wanted to sustain it, then I would just come in here and hold it. I tend to oscillate, and so you probably will do that too, just because that's kind of what you'll see me do. So, go ahead and try this technique.